Good afternoon, everyone. First of all, I would like to thank the MesoCare Foundation, who is located in Houston, for organizing this event, especially David Foster, who has helped countless patients with mesothelioma navigating through the healthcare system, especially with a disease that is pretty rare in the United States. I am Claire Verschraegen. I am a specialist of rare cancers, and my first encounter with peritoneal mesothelioma was in 1995 when I ran a phase 1 study of liposomal platinum that we were injecting inside the abdomen of patients with peritoneal carcinomatosis. Many patients with peritoneal cancer, especially mesothelioma, were included in that study, which gave some good results in some patients, and I became very interested in better treatment for this particular disease. So today my talk is going to focus on peritoneal cancer. Now, this is a very rare disease in the United States with about 300 cases per year. And so during my talk, there's going to be a lot of crosstalk between what is being done for pleural mesothelioma and how can this then be applied to peritoneal mesothelioma. And I will let you know what is peritoneal and what is pleural so you don't get too confused. I will divide my talk in 3 parts. First, I will describe asbestos. Then I will show you how peritoneal mesothelioma presents, and then I will discuss the treatment of peritoneal mesothelioma. So asbestos has been known for thousands of years and was used for different usage, mainly because this is a material that does not burn. So in the past, the Persians used to wrap the people they were cremating in blankets of asbestos to preserve the ashes. It was also used for the wicks of the virgin vestals in Rome. Pliny the Elder noticed that slaves that were working in quarry of asbestos died of lung cancer pretty young. And then some royalty used also asbestos cloth as something that was very chic because it didn't burn and they could play some tricks on their invitees. So basically asbestos is an insoluble compound that resists heat. It's very moldable, so you can make about any product with it where you need insulation. There are 2 different types of asbestos. One is very carcinogenic. These are the amphibole group, and the other one is less carcinogenic. It's a serpentine group. These are the different quality of asbestos in the serpentine and here in the amphibole type. And these are the chemical structure. Okay. So this is a picture of a serpentine asbestos called chrysotile. Chrysos means gold because their quality was so great, it was analogous to gold in the past, and tile means fiber. And then these are the carcinogenic type. You can see the fibers are much smaller and fine, and they look like little glitter, you know. And so when you look under the microscope, there are little rods that are not very large. And so these rods can be absorbed through the skin, through inhale, they can be swallowed, and they pass through tissue. They can move through any organ in the body. So in 1960, in South Africa, it was noted that asbestos workers were more prone to mesothelioma. And this was the first epidemiologic association of asbestos and mesothelioma. So 80% of patients that are diagnosed with mesothelioma have an exposure to asbestos if you question them enough. But only 5% of people that were exposed to asbestos are going to develop mesothelioma. And then asbestos exposure has also been associated with other cancers, mainly in smokers, lung cancer, head and neck cancer, small intestine cancers. A history of exposure to asbestos, even once, is enough to trigger a mesothelioma. However, the level of exposure is important, so the more you're exposed, the more your risk to get mesothelioma. But there is no threshold level that is safe. And when you do autopsies and look at the tissue that are contaminated with asbestos, you find this asbestos body. They look like bones. This is an electron microscopy picture. When you take asbestos and you do an Ames test, which is a test that looks at mutation in a Salmonella culture, basically those fibers are not mutagenic by themselves. You don't find more mutations after you expose the Salmonella to the fiber of asbestos. However, the asbestos induce an inflammatory reaction that causes chronic fibrosis as well as autophosphorylation on some oncogenic product. And we think this is the secondary chain of event that causes the mesothelioma. So these are the professions that are most at risk of mesothelioma because they are exposed during the course of their work to asbestos fibers. Quarry workers, construction workers, shipyard building, cement product, brakes of cars, generation of electricity, brick, ceramic, remodeling of houses because they were insulated with asbestos in the past. And if you don't use the equipment that is mandated by OSHA and you just do a remodeling without protection, you will be exposed to asbestos. So asbestos was banned in 1978, but there's still a lot of products around that contain asbestos. There is a latency of about 20 to 50 years. So if you were exposed when you were a teenager at age 15 or 18, you may develop a mesothelioma in your 40s. If you're going to get pleural mesothelioma, the latency will be shorter than if you're going to get peritoneal mesothelioma. For pleural mesothelioma, it's about 25 years, and peritoneal mesothelioma about 40 years. Most patients do develop the cancer in their 60s, early 70s. And then you can have a secondary exposure. So if you're the wife of someone that comes with clothing that's full of dust and you clean it and shake it, you get absorbed some asbestos, you can also develop mesothelioma. And these are questions you have to ask your patients when they present to you. There are other etiologies have been also thought of. One is an infection with simian virus 40. That was a contaminant in the polio vaccines of the 1960s, but the latest studies looking at the epidemiology of possible contamination with SV40 did not show an association with mesothelioma. Ionizing radiation and thorotrust can cause mesothelioma. And then there are some genetic susceptibility in family, especially in Turkey and in Dakota, where we don't know whether it's all genetics or if it's genetics plus exposure to a fibers called irionate. But there are family records of people that get mesothelioma. So this is a quick overview of asbestos and the risk of asbestos. This is a view from the peak of Sandia over the sad valley of the Rio Grande. And the second part of the talk is going to be a presentation on how peritoneal mesothelioma presents. So this is out of the SEER data, the epidemiology of mesothelioma, and you can see that the peak incidence for male is around 70 years of age, and for women, 75 years of age. So it's really a disease of older people. And I want you to remember those numbers because when I show you the treatment, you're going to see that all the patients treated are much younger than this. So there is definitely selection of patients. The diagnostic evaluation starts with noticing some calcified plaque on the pleura of patient. That's a witness of exposure to asbestos, not a witness of mesothelioma necessarily. Now, if someone presents with a pleural effusion and a calcified plaque, then it's becoming much more suspicious that there could be a mesothelioma hiding in the chest. A simple procedure is either a thoracocentesis or paracentesis, but the sensitivity is very low with only a 25% chance of diagnosing the cancer. So the diagnostic procedure of choice is either a thoracocentesis or a laparoscopy where you can biopsy tissue, and the tissue diagnosis is going to give you the diagnosis of cancer. And also at the same time of the thoracoscopy, you can do a pleurodesis to seal the lung to the chest wall and prevent a recurrence of the pleural effusion. The next staging workup after diagnosing the cancer is basically a good CAT scan of the abdomen and pelvis for a peritoneal mesothelioma, or a PET scan, especially to evaluate the lymph node in the chest, because if the lymph nodes are positive, chances are the patient will not be eligible for surgery. So I'm going to show you a few pictures on how the mesothelioma presents on CAT scan, and this is mainly peritoneal mesothelioma. But first I want to show you here the calcified plaque. So this is just a witness of exposure to asbestos, not necessarily mesothelioma. This is a thickened pleura. Again, this is not necessarily a mesothelioma, but the calcification tells you there was exposure to asbestos. Now here, this is a pleural mesothelioma with a very thickened rind, and then when you do a PET scan, you see it's very metabolically active. And here we go to peritoneal mesothelioma. This is a quite subtle diagnosis. So for the people that can read CAT scan in the room, I think you're going to figure out there is some ascites around the tip of the liver. These are the two kidneys and the spine. The contrast in white in the small bowel. And then if you're very attentive, you're going to see here between those colon part a little thickening. Well, this is the omental caking that one sees when the mesothelioma invades the peritoneal cavity and gives peritoneal carcinomatosis. This is pretty subtle. This is the same person cut a bit lower in the pelvis, and you have here the mesentery. And if you look very well, it's a little bit thickened with edema. There may be some nodules here. This is pretty typical of peritoneal involvement with a carcinomatosis, and we see that a lot with mesothelioma. And then if you look better, you're going to see here the omental caking with a thickened omentum. Usually you do not see the omentum if it's normal on a CAT scan. This is a patient of mine who had that omental caking, and the tumor invaded the abdominal musculature, and so you could palpate a lesion when you examine her abdomen. This is another patient of mine with a huge omental caking before treatment. After treatment, she received surgery and chemotherapy with a port to give intraperitoneal chemotherapy. The disease is completely disappeared. And here is a patient that was not so lucky with, again, the omental caking here. And 3 months later, despite treatment, the disease has progressed with liver metastasis. And this is the last picture I'm going to show, which is a partial bowel obstruction. B stands for bowel with a bit of contrast. A stands for ascites. And then if you look here, this is a remnant of omental caking. Unfortunately, this patient is having an obstruction related to the progression of peritoneal carcinomatosis. Now I'm going to switch to the pathologic diagnosis. There are basically two different types that you have to think of. The diagnosis of peritoneal mesothelioma is really a continuum from almost benign disease to extremely malignant disease. And so in the benign or low malignant potential disease, there are two different types. One is called well-differentiated papillary mesothelioma. The other one is called multicystic mesothelioma. I'm going to show you some pictures later. And then in the frank invasive cancer, you have basically three major types, and then one called also desmoplastic, which is in fact with a worse prognosis than the other one, but extremely rare. The most common one is the epithelioid type in about 90% of the patient. Biphasic is a mixture of epithelioid and sarcomatoid, and you need to have at least 10% of each component to call it biphasic. And then sarcomatoid is about 5 to 6%. And often the pathologists will confuse this with an adenocarcinoma because the cells are very bland. So this is an epithelial mesothelioma. This is a sarcomatoid mesothelioma, and you can see that that's the same tumor is staining with epithelial marker of keratin, usually 5 and 6. If it stains with 7 and 20, it's probably not a mesothelioma. So when you look at the sarcomatoid, what are the differences between sarcomatoid and epithelioid? Well, epithelioid is much more common, and sarcomatoid is less common. Out of 326 patients, mainly men were affected with sarcomatoid. Mainly in the pleural cavity, about 98% of them versus 2% in the peritoneal cavity. Cytokeratin stains are positive in 93%, calretinine only in 1/3 of the patient, and vimentin, which is a marker of sarcoma, in 90% of the cases. Median survival is worse, 3.5 months versus 12 months for all comers. Pleural plaque are very common. Asbestos exposure in 1/3 of, asbestosis, which is the inflammation related to asbestos exposure, in 1/3 of the patient. And the median asbestos is usually higher in sarcomatoid than epithelioid. Now, when we look at the other spectrum, the less invasive or non-invasive type of mesothelioma, we have the well-differentiated papillary mesothelioma. You can see all the little papillaries here, and this is a higher magnification. They stand for calretinine and D240. And this is the multicystic mesothelioma, which has all this cystic cavity here. And this is how it looks when you open the abdomen. You have all this cyst, and it looks really like a nest of frog eggs or grapes.